Welcome to Recovery Equity, a series of conversations about how we can reach and help more people find freedom from addiction. This is a space for us to reflect on some hard truths and to consider ways forward and even new possibilities. My name is Quinn No, and I'm a licensed clinical psychologist. But right now, I primarily lead research at the Hazelden and Betty Ford Foundation. Today, we are discussing the South Asian experience in the United States with a focus on culture, women and stigma, addiction, and barriers to accessing care. We're here with Raj Chowdhury, the Chief Operating Officer of SEWA, Asian Indian Family Wellness Organization. This is a wonderful organization focused on the health and well-being of South Asians in the Twin Cities area of Minnesota. Welcome, Raj, and thank you for being here with us and sharing your wisdom and expertise.
Thank you, Dr. Quinn.
Before we get started, could you share a little bit about yourself and tell us about your work with the South Asian communities here?
Sure. My name is Raj Chowdhury. As you said, I am the Chief Operating Officer of SEWA, Asian Indian Family Wellness Program. I was born in a small village in India and did all my education in India, then followed my husband into marriage to US for further education in Missouri and then on to Minnesota. And so here we are since I've been a long-time resident of Minnesota. I consider Minnesota as my home and Minnesotans as my neighbors and my family. So here we are.
You have such a long history with the South Asian community in Minnesota that you really have watched the entire community grow to what it is today. Part of the reason why I wanted to have this conversation with you today is that in Minnesota, in the last year and a half, there's been a lot of social unrest, particularly around the murder of George Floyd. And that has sparked conversation and experiences across many of the communities of color in Minnesota. So can you share a little bit what the impact of racial inequities and health disparities has been on the South Asian community?
Absolutely. Dr. Quinn, it has been one horrendous year, I would say. First of all, in March of 2020, we had the pandemic. And then while we were still into the pandemic and trying to get a grip of it, then came the George Floyd incident. And our office is in very close proximity on Lake Street from where the incident happened. It was too close to home and it hit us very hard because much of our staff and our survivors live in the area. It was a night when people were running from there were buildings on fire, and we were moving in with a van to rescue women and children from shelter to safe hotels. So not only that, our whole program went into pivoting all our program from in-person service to remote. That was a challenge itself. And our community, while we were still recovering from George Floyd, and then this year alone, there has been a lot of Asian hate crimes on our communities, where we have been confronted into the stores by everyday people, because if you are wearing a mask that you are Chinese, you just leave. You people are the one creating all these problems. And to top it off, I would get a call. We have a 24/7 crisis line. I would get a call in the night, 3 a.m., or a text from a survivor who would say, there's shooting going on here. And I got chased down the street. My baby is up. What should I do? So, and there was a lot of mental anguish and anxiety and depression and isolation during this period. Our seniors were very vulnerable. Our youth, we have never seen so many mental health requests to come and see us in the college kids. Our couple therapists that we have three of them. Couple of them are extremely busy, given the time that we are a small agency, and we have dedicated few hours a week only for mental health sessions due to it could be domestic violence, it could be intimate violence or other racial tones, anything, job losses, students not able to participate in their classes. They are now stuck with in the home, and so there were a lot of mental health issues going on at the stage, and no culturally specific services available. Domestic violence, women were all the more vulnerable and will not report. They couldn't make that call to us because of being at home or stuck with the perpetrator. So those are the things that we faced, and then to not to be able to go to a physician due to COVID-19, and there was not much available. So the only thing available was our phone calls that we did, telephone assurance calls to our community members, to our survivors, to our disabled homebound people, and to the seniors. So those were the ones that our agency came forward because we were connected to them for 16 years, that we were able to stay in touch with them. Those were the ones we followed. Our order for protection for women, it took a long time. Even some of the cases that is happening in the court system, we're not able to get appointments. If someone wants a divorce, you couldn't do it because the date falls in September or December, and she has to live with the person for another 6 months or a year. So the mental anguish is so much there and not much help available. They don't trust the system. They do trust the agency that is culturally specific for them. So during this time, we were able to provide our community with first of all, the COVID-19 testing, then now it's the vaccines, and the much needed mental health telephone calls that we could make. Most of our staff has mental health first aid, so we are able to take that first call and then send them over to the specialist. So all these things happen, and at the same time trying to get some data from our from MDH or CDC is just not there.
So the Minnesota Department of Health.
Yeah.
So
it's just not there.
Yeah, sorry. So Raj, I'm wondering, have you seen an increase in alcohol use or substance use in the South Asian community, given the stressors and the social unrest in the past year and a half?
Absolutely, absolutely. What else stores are more open than the liquor stores?
So, and you mentioned data briefly there. What do we know about rates of substance use in the South Asian community?
We don't. And it's such it's a hidden myth. And when we find out young deaths happening, male, female, and then they say they died of heart attack. Really? Is that what it is? You die at age 24 of a heart attack? So they're totally not going to share any substance abuse or overdose. We've had many cases come to us with people just trembling and or motorcycle accident happening. It just comes to us too late.
Mhm.
The education is not there. The numbers, the data is not there. We're not able to deal with this effectively.
So we need more data. We need more information about prevalence rates and severity and frequency of use. What is important for providers to know about things that need to be included in a culturally specific treatment program, and how to work with and for the South Asian community around addiction and mental health services?
On personal level, I think it's best to know the culture of South Asians, where they're coming from, what the family structure is, and to deal with even the LGBTQ. There's a sizable LGBTQ communities, but no one knows about them. SEWA is the only organization that has the first South Asian Queer League program. Those communities are totally ignored. Then we have the children program is also not, is bringing in the children's also. I don't know if that's the area you cover or not, but because of the big parties happen, there's drinking going on and there's no supervision. So they start early and that data is not there. So much needs to be done for this community, for data. We did a survey in 2012 for health disparities that exist. And we took about 1,000 surveys under the project Sehat. It is on our website, and found out that three big issues are that we addressed at the time, because we were looking for heart disease, diabetes, and lack of nutrition. Those were the ones that we addressed. We did not address substance abuse, just because it was not the thing to do. That this survey will be shunned the minute we put down alcohol or substance abuse. I am sure, 100% sure, that if different kind of social drugs came in front, our community will not recognize. They themselves don't know. Alcohol, they know for sure. But other social substances, they do not know. So education on this matter will be good. We also have been doing a study with Carleton College as adverse childhood experiences as it relates to domestic violence. And we did put down that alcohol survey in there, whether so let's see how that study comes forward. There's just no data.
So more data, and sounds like more services that take into account.
More services that are culturally specific, and education.
Yeah. And I love that you also mentioned a program for sexual and gender minorities at the intersection of a sexual and gender minority identity and South Asian identity.
Yes.
I would imagine there are very specific needs there as well.
Absolutely, there are.
So, we started out talking about the social unrest and the impact on the South Asian community. And, I know sometimes relations are not always smooth between Asian communities and Black communities. But given the rise in anti-Asian hate crimes and the experiences that we're having, how do you think Asian American communities and Black communities can come together, pool resources, work together to address some of the social justice issues that have come up for both of our communities or all of our communities?
I think it's our communities, and the solutions I see is that we need to align with each other. We need to create programs in partnership. The more we do jointly, the better we are off. You're just better off joining the Black communities. We've had many people that we serve. As a businesswoman, I've had many partnerships with Black people. It is one of those things that we need to partner and in every board committee member that we take a partnership with the Black communities.
Mm-hmm.
It's like fear of the unknown. Let us partner together. If I think they have more problem, then let us help each other.
Mm-hmm.
That is my take on this. We need to be together as BIPOC communities. We, as a block, we make more impact. It's a matter of, it can also take a political scene that we have our own caucus. That's needed. So a lot can happen here as long as we are together.
Excellent. I love those parting thoughts. Thank you so much, Raj, for joining me again and for sharing your heart and your expertise today. On behalf of everyone watching or listening, I want to express my deep gratitude for your taking your time in speaking with us today. You've again given us so much to think about, a lot to put into practice. And to everyone out there, please let your friends and colleagues know about these conversations and come back often to catch more episodes of Recovery Equity. Together, we can build a healthier, happier, and more equitable tomorrow.